We know that children and teenagers who have issues with attending school are much more at risk of a number of concerning difficulties, lots of mental health issues, suicide attempts, risk-taking behaviours, violence, teenage pregnancy. And this is a major problem at the moment that our service, KINS, is facing. We're seeing more and more kids with this very entrenched refusal of going to school.
So what we're proposing instead is a multi-family program, which is focused on getting kids back to school as soon as possible.
To heal us physically, you must heal us spiritually, culturally, and mentally. We want to incorporate traditional Aboriginal healing, Nunkery, into a Western-based model, which Northern Sydney Local Health District Aboriginal Health Service envisions that the Nunkery clinics will provide a holistic health service and build trust with and engage Aboriginal and Torres Strait Islander consumers.
Many of the clients of the Aboriginal Health Service have complex mental, physical and social and emotional well-being issues. By incorporating with the Nunkery into our Western health model, we can start to address more appropriately with the intergenerational trauma, health and social emotional well-being in a culturally appropriate manner. At the community level, we can anticipate the Nunkery interventions will lead to ongoing cultural connection and reconnection, and really the potential to build capacity within the area as well as up and down the coast is huge with this.
The actual realities of being admitted into hospital can actually be quite overwhelming. We know that it can be a challenge for staff to help patients experiencing high levels of stress and anxiety. And as the World Health Organization has told us in a statement in 2007, really there is no health unless you've got mental health.
So what is our idea? It's a pilot project with ethics approval to create a high quality, free-to-air bedside TV channel. The channel will provide a variety of wellness information, including guided relaxation strategies, tips to improve mental health and stress reduction techniques. The channel will be run over a 3-month period as part of a pilot project on Ward 9A at Royal North Shore Hospital.
So all we want to know is, will you help our patients change channels?
If there's one thing that you should take away from today, it's don't go breaking my heart. Elton John knew it, Kiki D knew it, and by the end of today, you will too. What is heart failure? It's a complex clinical syndrome, and in simple terms, it's when your heart cannot meet the metabolic demands of your body. Imagine if there was a way for us to look inside someone's chest and actually measure cardiac output, manage how much fluid they have, and help control their medications. Enter the PhysioFlow. Now this is a device much like your telemetry unit. It's non-invasive. We'll be able to get information on diagnosis, what kind of heart failure, how to manage that heart failure, and give patients a visual representation of how their heart's doing. Thank you.
I liked all the presentations. They were very interesting and thought-provoking.
And I thought the way that they all presented their ideas was really engaging.
I've got a vested interest in the Get School presentation because it's a big problem within the service that I'm working in.
I think when other clinicians and other hospital staff see the pitch, it definitely has like a ripple effect, and it makes other people want to think of simple, innovative ways to improve the way they do work and how they deliver care.
Now, we did struggle in relation to the winner for today, and we've come up with a compromise. We have joint winners. So I'll start off by saying that switching channels with Susie Russell, Carol Barnes and Vanya Ripley, if you can come back. And Anupam Rao for the PhysioFlow.
There can be a lot of friction, barriers for clinicians, nurses, any hospital staff to create something new, but the Innovations program allows us to think big ideas and gives us support that we need to try and turn those ideas into reality.
I think it's a wonderful thing because it really encourages clinicians to be moving forward with their ideas to help with patient care and incorporate innovative ideas into their sort of plans.